Today, we are live at the Ethiope East Local Government Council, Isiokolo, the Legislative Chamber, for the public hearing on a bill for the establishment of the Primary Healthcare Center in Urodo, Ovu, Ward 18.
It was an impressive turnout of community members, government officials, stakeholders, and well-meaning indigents. The hearing commenced with a welcome address by the Leader of the House, Right Honorable Emojeya Emmanuel.
You are welcome to the Legislative Chamber of the Ethiope.
Following his opening remarks, the sponsor of the bill, Honorable Oganamaru Kingsley Eyanu, formally presented the bill before the gathering. In his presentation, he outlined the rationale behind the proposed bill, highlighting the date the bill was first introduced before the House.
A bill to promote for the establishment, management, and operation of the Urodo Primary Health Center. Therefore, establish a primary health care facility to be known as the Urodo Primary Health Care Center, Urodo PSC, in Urodo Disek Ward 18, Ethiopia's local government area. The center shall function as a frontline health institution, providing primary health care services, health education, preventive programs, and material and child health support.
The floor was subsequently opened for public contributions, allowing stakeholders and community members to express their views on the bill.
The function of the management committee not overlap with that of the eight personals and the bills, except the functions will probably spell that, so there won't be any overlap on configured source of funding and financial management. That an account will be opened for that primary health care center. Now let's look at the source of funding. And you know you are assigning to when to pay bills, medical bills. And if you look at the policy of the state, 0 to 5 years, free medical treatment.
Established management system, which ought not be toppled again. Because by bringing this up, it will cause more chaos and confusion.
Financial management. Number 3. The account of the center shall be audited annually by auditor appointed by the local government for the project. We want to amend this area. If the local government do not have auditor general, we have internal auditor. Discipline and ethics. Any staff found guilty of gross misconduct may be suspended or dismissed in accordance with the due process. The due process here means what?
I believe that rule of law has already been established to govern this new
Thank you.
I think there should be a waiver to an extent. Let the young ones, the pregnant mothers in this facility, they should be able to access free healthcare, even the elderly, when it is established.
At this point, advise or put in my little contribution that if the heading of this bill can be expanded to a more broader name, like let's say a comprehensive hospital.
Imaka Ogun, Agbamu, Urodo, Asuru, Onokobaru, Okoluke, Owerri, and Ipawu. Now these communities are all under Ward 18.
Maternal services should not make people go up to a tertiary hospital. Those are incidents or situations that can be handled within the health center.
Participants commended the initiative while offering constructive recommendations, including the expungement of certain words and the correction of identified errors, further strengthening the proposed bill.
Yes, the bill is a very good one. It's something that we should work on immediately and put into action because it's going to affect and benefit the people from that region.
It's a very good one.
That it should be passed within the shortest possible time.
Because in the seven communities that we're talking about, I have primary schools there. And at times when the children, maybe they injure themselves, we're thinking of where to rush them to. So I'm so happy today. And I pray this health center will be established so fast.
We'll be most grateful if this bill is speedily considered and the establishment of that health center.
A bill cannot come to a public hearing and will be thrown away. I want to assure you that this bill will come to passage very soon, as soon as possible. And when it comes to implementation, please, I want to advise the community you have a very big role to play. After this bill has been passed to law, executive chairman, the executive will make plans to implement.
The overwhelming support expressed by contributors reflected the community's collective desire for improved healthcare infrastructure. Following deliberations, a motion was moved for the adoption of the bill and duly seconded.
I move that this bill should be approved.
Second the motion by the years that this bill should be passed, approved, and implemented. Have you listened to the motion moved by Honorable Chief Rose Esiso to approve and adopt this bill? Abel seconded by Odibo. I want to put the question to this house so that you are aware that the motion is already on the ground. Those in favor that this bill should be approved and adopted, almost immediately should say aye. Those against should say nay. The ayes have it.
The public hearing concluded on a hopeful and reassuring note. I am Faith Ebiweri reporting.